while wellbeing champions were out and about, I'm sure you've seen them at one point or another, knocking on your doors, talking to you at events. They came back to us with your reservations around vaccines. We've listened and we've put a session together to address some of your questions. Today we have an expert panel joining us. Welcome to Dr. Priya Kumar. Dr. Kumar is a GP partner at Kumar Medical Center, Health Inequalities Lead, Slough, and a Connected Care Clinic Lead. And welcome to Dr. Nithya Nanda. Dr. Nanda is a GP partner at the Clinical Director Spine Primary Care Network, Slough, East Berkshire CVD and Diabetes Clinical Lead. There'll be an opportunity for more questions at the end. Please submit your questions via the chat function and we'll get to you as the session progresses. Please note this session is being recorded. So this session, along with previously recorded sessions, will be on our webpage. So please go to our webpage for any information. You can also email us, and I will put the email addresses along with the webpage address on the chat function. So this is how you will get in contact with us. Now I'm going to hand you over to Dr. Kumar and Dr. Nanda to give them a chance to introduce themselves before we dive into the Q&A. We'll start with Dr. Kumar.
Thank you so much. Thank you for giving me the opportunity today to come and talk to you all, to answer your questions. Please be free to ask any questions you would like, no questions silly. So I'm Dr. Priya Kumar. We've been obviously going through the COVID pandemic, and I'm the Health Inequalities Lead for Slough, and I'm here to answer your questions.
Thank you, Dr. Kumar. Dr. Nanda?
Good morning, everyone. Glad to be here, and it's an opportunity to connect again, especially the community champions, and for the tremendous work you guys have done over the pandemic. It's been a heroic effort from everyone. We've started to live with the virus now, and there might be a few questions in mind. We're here to answer that, and yeah, glad to be here. Thank you.
Thank you, Dr. Nanda. Thank you, Dr. Kumar. It's really lovely to see that there's so many of you in the room today. So I hope we managed to answer a lot of your questions. I'm first going to go through a list of questions that we've put together that have come directly from the community. So our first question that we have is, it's the understanding of some of the community that they do not need the vaccine due to restrictions being lifted. Can you please address this, Dr. Nanda, Dr. Kumar?
So I really wished it was the case that we didn't need the vaccine. Unfortunately, the virus is always trying to be ahead of us. Although the restrictions have been lifted, you have seen in the news and in the workplace or in the schools that COVID cases rising. So it's not necessarily the end of it, the vaccinations and the restrictions being lifted. We are seeing a surge in cases, and it can start getting worse in the winter. So the government has already planned and is implementing an autumn vaccination season as well. So one would expect that COVID vaccination will be becoming part of the winter flu vaccination as well. So, simply in answer to the question, I don't think we have won over COVID yet, and we might just need to start living with the virus and start being ahead of the game in terms of managing to keep the infections down and hospitalizations down, and hence the need for vaccinations, perhaps on an annual basis, I think. Priya, do you have any other thoughts then?
Well, I think it's just, as Dr. Nanda said, it's the best way to protect yourself as well as those around you. So even though you may not be as vulnerable as maybe your grandparents you're living with or other members of the family, it is important vaccination is a way to reduce the spread of the virus as well as catching it yourself.
Okay. Thank you. The next question. There's a belief that once you've had COVID, you do not need to have the COVID vaccine. Is this true?
Not really, because yes, natural infection will provide some immunity. What we have seen over the last 2 to 3 years, since 2020, since the COVID pandemic began, we've seen multiple variants of the virus. So you might have had the infection for one variant, but you will be susceptible to any new variant comes on. So the vaccinations tend to provide and have shown good immunity production, even for multiple variants as well. Having said that, you never know how the future variants can look like and whether they would outsmart the vaccine and the previous infection immunity as well. So vaccination affords better protection and also a longer period of immunity potentially. The current studies shows that up to 9 to 12 months, the vaccination can afford the immunity, and it needs to be a full regime of vaccination, not just one vaccine. So let's not be complacent that you just had an infection and you don't need the vaccine. Of course, after 4 weeks, you can have the vaccination. And I would certainly advise, especially for the vulnerable and the immunocompromised and also the over 65s, that the community champions promote the need for vaccinations on a as and when it's offered, actually. Yeah.
Lovely. Dr. Kumar, do you have anything to add to that?
Oh, I was just going to add about the vaccinations. It's really important to have 2 of the vaccines, not just one, to get you the full immunity against the COVID-19. There is statistics that have shown that as the booster increases your antibody production, which is the way we fight infection against it, it goes up to about 75% and 88% in more severe disease. So actually, if you think about us giving you 2 vaccines to increase your booster and your immunity, that's the same as you catching COVID, waiting 4 weeks and getting another booster, because it increases that protection. And that's why we've been giving multiple boosters to basically ensure that we protect you against all these variants.
Okay, thank you. My next question was actually, there's a belief that one vaccine is sufficient. So I think you've covered that already. So we'll go to our next question, which is, some people are hesitant to take the vaccine as they believe they can infect other vulnerable members in their household. Can you please explain that?
So I think it's a myth, and I just wanted to reassure yourselves and the people you're going to talk to that vaccination is not going to be doesn't contain the live virus. It's a synthetic molecule that has the same structure to the virus spike protein, and it in itself is not going to cause any infection. So if you're thinking vaccination is going to infect other vulnerable members, it's actually the opposite. The vaccination is going to provide a ring of protection for the family, because you get vaccination, you're protected, and you go to work and you come back from the workplace or the schools or the community surroundings. People who are at home who are vulnerable will not have that kind of transmission that normally people who are unvaccinated would have had. So in fact, it's going to more protect you and your family if you have the vaccination, rather than the belief that it is going to infect other vulnerable members in the household. Yeah. Mm.
Thank you. Dr. Kumar?
Dr. Nanda said it beautifully. As we've said, it's having the vaccine is not only protecting you, but it's protecting the spread of the virus. And you know, as we said, our Salt Hill is still open, isn't it, Dr. Nanda, for people to come in, get their vaccination. We really want to encourage people, especially before the winter, to come up forward, because you know, we'll have all these other viruses as well in winter, and get yourself protected early to prevent even further serious illness.
Thank you. Before I go to my next question, I'm going to remind you all, if you do have any additional questions, please can you submit the question via the chat function, and we will get to them at the end of the session. My next question is around fertility. Can vaccines affect fertility?
So up to date, at the moment, there's been no evidence that COVID-19 vaccines affect male and or female fertility or cause any increase in miscarriages. There's no evidence out there at the moment. There's no need to avoid getting pregnant. Once you've been vaccinated, it actually is protective prior to getting pregnant. And there's been no evidence that it affects your baby getting the vaccine done in pregnancy in any way or form.
Thank you. Dr. Nanda?
Yeah, I just want to reemphasize what Dr. Priyakumar mentioned. In my experience for the last 2 years, I've seen pregnant ladies have been affected by the illness, especially those ones who haven't had vaccination, and they've ended up with real bad complications in the hospital. There is this disinformation going on in some of the communities. I've seen that in the communities where vaccination uptake is low, and I would really urge the information to be made clear in a more reinforced fashion that pregnant ladies need protection. In fact, it's the viral illness, the COVID infection, that is going to cause more complications than any minor side effects the vaccination might cause. So definitely pregnant ladies would need protection. Go for it, because there have been thousands and hundreds of thousands of patients across the world who have been pregnant and have had vaccination, and they are safe. So there is evidence out there, real life evidence. Yeah.
Thank you. Sorry. The next question is, you've covered pregnancies and vaccine. Can you please elaborate on breastfeeding and vaccine?
So I was actually pregnant, and unfortunately I did get COVID before the vaccines came out, and I wish I took my vaccine. I wish the vaccine was there when I was actually pregnant, and I would have happily had it. So I had the vaccine while I was breastfeeding. As soon as I could have it, I had the vaccine to protect myself and my son to an extent. And as we know, with pregnant ladies, they are at higher risk, as Dr. Nanda said. They're high risk of hospitalization. They're at higher risk of serious illness from COVID-19, and we know that the side effects just don't exist when you're pregnant. There's no effect to the baby. There's and you're protecting yourself from serious illness before labor, as well as in breastfeeding. So even if you are pregnant and you can get the vaccine, would get it now. If you're breastfeeding, please go and get it now. There is no side effects to you or your baby. And I'm living proof of that. I've had the vaccine while I was breastfeeding, and I tried to get it as soon as I could to protect me and my family.
Lovely. Thank you. That's a really nice thing to hear. Experience speaks volumes. Sorry, Dr. Nanda, did you have anything to add about breastfeeding?
No, nothing. I think the personal experience.
Yes.
I couldn't have been pregnant. I couldn't have been breastfeeding.
Okay. And my next question. Can you take the vaccines if you practice veganism or if you are vegetarian?
Yeah, so that's another myth as well, isn't it? There's a lot of anti-vax campaigning, and any little extra disinformation, one would hope people would not get vaccination. That's not true. Pfizer vaccine and or the Moderna, none of these contain any meat derivatives or animal products or any egg. So it's one of those beautiful technology innovations in the last 10, 15 years that we have this biotech engineering that has meant the molecules are produced in the lab that are really very similar to the virus spike protein, and hence there was no need for incubation in the egg, just the way the flu vaccines are derived from. So I can reassure you that it is vegan and vegetarian friendly as well. Yeah.
Lovely, thank you. Sorry, Dr. Kumar, do you need?
No, that's covered it.
Okay,
it's
lovely.
Yeah.
The next question.
There is a good information database for those of our patients and community champions who would like to have more information. The British Islamic Medical Association have produced a helpful guide. So if you visit that, if you Google British Islamic Medical Association, you'll get umpteen amount of information on that. Yeah.
Thank you. Next question. There has been concern around side effects, especially related to myocarditis and pericarditis. Could you please address these concerns?
So this has, with the Moderna vaccination, we've seen a few signals across the world of the patients, young patients, especially younger patients, attending to the A&E with chest pain, and they are found out to have some slight inflammation of the lining of the heart, and that coincided with using the Moderna and Pfizer as well, but that this is far and few, not to the extent of the kind of clotting phenomenon which we saw with the AZ vaccination. So even if there is any such inflammation, it's only very short lasting, and we tend to see that in the younger population, and it settles down because the vaccine itself is going to cause that immunity. The body can get inflamed, and this is short lasting, and that itself is not a good reason to stop getting vaccinated. Just touching up on side effects, after the vaccination, you might have other side effects as well. Very mild, can last for 1 or 2 days or 3 or 4 days, like sore arm, feeling tired, feeling achy or headaches, and very much flu-like symptoms. I had it for the first time when I had the vaccination. The second dose was good for me, but I did have some flu-like symptoms in the first 2 or 3 days. I can reassure you that patients have recovered well following rest and simple treatments, and that is very rare occurrence of these side effects. Each of us behave and react to medications in different ways, and these the episodes of myocarditis or pericarditis has been seen in very rare instances. So worthwhile if you develop any such symptoms to seek medical attention, and most of it settles down with simple pain relief medications. Yeah.
We've got to remember more than like 1.9 million children have had it, and this is extremely rare complication. And what we need to be more worried about sometimes is what's showing in children is long COVID. Actually, you know, we have now nearly an estimated 1.3 million people in the UK with long COVID, which is a lifelong. At the moment, we can see effects of COVID, and people aren't recovering as well from it. So by getting vaccinated, you're protecting yourself from the immediate infection, but also from long COVID, which obviously we don't want any of our children in the future to have.
That's true. So as the message is, please get vaccinated. But if you have any questions, like I said, please put it in the chat function. Go into the chat function. We have one question there from Shahid. One of the questions asked by a number of people during the campaign: when would people under the age of 75 be given the 4th jab?
Yes, thank you for asking. That's a very relevant question. And what the government and the NHS England does is it follows the evidence base and the benefits versus the risks of any vaccination, and what the benefit for the younger population is. So based on all the information, the most we might be able to see would be the autumn vaccination coming up as the 4th booster, basically. Couple of months soon, in September, October, you'll be noticing that there'll be call for vaccinations even for under the age of 75. If you remember, in the last 2 years, flu vaccinations was offered for 50 and above, and this might be the case for COVID as well. Let's wait and watch and see how it goes. Yeah.
Thank you. Dr. Kumar, anything to add there? It's just
not a, it's just a wait and watch. We know as much as you do, and as soon as we know, we'll let you know, because we do want you all to get vaccinated as well.
Lovely. Thank you, everyone. If there's any more questions, you can either raise your hand right now or put your question in the chat function. I'll give you a second for that. Just double check. Okay. I think we've covered the, okay, sorry, I do have Zora. Zora, can you unmute yourself, please? I think she's disappeared. Zora, are you still there? Sorry, I think we've lost Zora, but I've got a question from Rosa. I'm not quite sure. Address the questions restricted to COVID or COV. Sorry, Rosa, I'm not entirely sure what you mean by that.
Sorry, you know, is that my phone typed? It should be are the questions restricted to COVID, or you can ask any other questions. Sorry about that.
It's okay.
As long as that question is regarding, oh, I can't get an appointment with my GP, how can you do sort of thing?
Oh, it's not that, but it's totally not. Yeah. You know, I just hear some rumor. I don't know whether it's true or not. It said, you know, if you sought treatment from a private health, you know, or whatever, insurance or GP, then the GP can take you off their list. So I'm just wondering whether it's true or not, you know.
So there's definitely a rumor. So NHS is under a lot of pressure, and any amount of private services and help for our patients is gratefully appreciated. It'll take the pressure off. And if you are able to look after your health and basically approach either NHS or private health services for your health needs, that's entirely your choice. Nobody can stop that. And in fact, as soon as my patients come and talk to me and say, Doctor, I've got a private healthcare. Can we do this through private? I would say, yes, absolutely, because if you're going to access your private healthcare, I will be doing a referral right here, right now, and I will do the referral and give it to the patient so that they can take it off. So every patient who's been seen in the private sector, that means there's one patient less waiting in the NHS. So I would welcome that approach as well. I'm not saying that everybody should go for it, but if you have the means, absolutely, yeah.
Okay, thank you very much. Thank you.
Thank you, Rosa. I have a question.
If you would like to have more patients like that, I'm happy to register in my practice rather than taking them off.
So I come to you then.
Absolutely. Absolutely.
So,
but what I can't do is see you privately if you're registered with me as the NHS GP. Yeah.
Yeah, thanks a lot for your answer.
No problem.
Thank you, Dr. Nanda. Thank you, Reza. Question from Mary Abrahams. How many cases of COVID are there in Slough? Do we have any numbers from you?
I would pass that question. Priya, do you have any idea?
Sorry, I don't have updated numbers, to be honest. We should have got that, but we can get you that and send that through to you. But we do know they're rising. That's the one thing I could tell you, and I think there is an increase in hospital admissions at the moment. That's definitely happening due to the variant that's out there. So as we keep urging you, get your vaccination. It protects you against these variants, which is slightly different from when COVID started.
Yes.
And as Dr. Nanda said, we think there'll be an annual vaccine, so this is to stay. And with what the evidence is showing us, and just as we protect ourselves from the flu every year, we're going to have to start protecting ourselves from COVID every year.
So thanks, Priya. I just wanted to add to that. The reason why I'm saying pass is because the government has stopped testing, isn't it? So
yes,
you can easily double the number that's detected if you get my drift. Juanita in the public health, but Dr. Juanita Datta in the Public Health Slough Council will be able to give us some figures, but that figures are underreported figures because people who are getting COVID infections, they don't have means of getting that tested. Some get tested if they have the means, but it's not necessarily a regulated thing now to get every COVID tested unless it's for workplace or the healthcare sort of setting. So yeah, I would easily think that we have rising cases in Slough. Although we can't quote a number, we need to make sure that we take all the protection. When I say that, it's hands, face, and space individually, trying to self-isolate if you get any illness of that nature and confirm, and try to make sure that you do personal kind of protection. That will help a lot for the community. Yeah.
Thank you, Dr. Nanda. Zora, if you can ask us your question now.
Yeah, sorry, we have to go back because I'd lost you before and I was trying to answer the question of under 75s to get the 4th vaccination. Is it necessary for the under 75s to actually get a 4th vaccination? And what is the purpose of having that 4th one?
Sure. So as I mentioned earlier in the meeting, the vaccination that we have had, for example, my last vaccination was about 6 months ago. There is no evidence that the vaccination will work for lifetime or the vaccination will work for more than a 9 months or 12-month period. So if you have had, for example, the 2nd or the 3rd dose last year, and you're entering the winter season and all the winter viruses start multiplying and replicating, if you're not well protected, even as an under 75 or under 65, then you will be a cause for transmission. So the virus will use you as a transmitting agent, and the patients, the younger people who are in contact with their vulnerable family members can transmit the virus rather than just have it. So vaccination will provide that ring of protection, and that's important, and also for your own personal protection as well. Yeah.
And as Dr. Nanda said before as well, we get the flu every year because the actual flu virus changes, and that's how viruses work. They mutate and they change. The COVID, as we keep hearing, that the Delta, the Omicron, the next different variant, vaccinations is the only way, just like we manage the flu every year, to try and protect yourselves as much as possible, because we do know the virus continues to change.
Thank you, Dr. Kumar. I have a question from Geraldine. Is it safe to take the vaccine if you have a history of blood clots?
That's a very good question. And we had that issue, especially with the AZ vaccination, because there was increased signals of blood clot formation with AZ vaccination. And since then, the whole focus in the UK has been on using Pfizer and Moderna vaccinations, which don't have that amount of incidence rate. So you would, if you have had clotting disorders in yourself or your family history, then it's worthwhile double checking with the specialist, the hematologist, before we go on to, although the current evidence says that the COVID infection itself causes more increased rates of blood clot than the vaccination itself. So you can gauge and make your own decision based on that, actually. But if you are suffering with serious clotting disorder issues, then hematologists need to be involved and their guidance need to be taken as well. Yeah.
Thank you, Dr. Nanda. Next question. What are the main differences, if any, of new variants that have caused the increased infection rates?
So I am not a immunologist or a biochemist, but from what we have heard, the main differences are with respect to how it changes in the spike protein structure. The virus is very clever. The spike protein structure changes the mutations in the spike protein are primarily responsible for the variants. Interestingly, the new variants, apart from the Delta, the new variants are actually weaker and weaker. The way the virus survives is trying to move from one body to another. And to do that, it needs to be very easy to multiply. And when it does that, then the amount of infection it can cause in a body reduces. So it becomes more transmissible, but it'll lead to less complications. So it becomes weaker. So that's what we have seen with the Omicron variant. Do you agree with me on that, Priya?
Yeah, absolutely. I was going to say, even though it's weaker, it spreads more quickly. That's the main difference between the different variants. And, you know, every time you catch COVID or we're giving you the vaccine, you're building immunity against that virus. And therefore it's trying to change, but becomes weaker every single time as well. So in that sense, again, as we've all been urging all our communities to do, is get vaccinated, because it'll only make the next variant even weaker as well. And the more immunity and more herd immunity we have, which what we mean is, you know, preventing the spread of the actual virus because we're protected ourselves, will make us stronger against the virus.
Thank you, Dr. Kumar. I've got a question from Shahid. You've got your hand raised, Shahid.
Good morning, everyone. Good morning, doctors. Brilliant work. Really appreciate the other day when at Breastfeeding Community Center, good information for many people. One of the questions when we are out and about door knocking, telling people about the importance of COVID-19 vaccination, not very frequent, but it's been asked, is it worth taking any kind of supplement like vitamin D or zinc to carry on daily basis to increase the immune system? So
there is no evidence to suggest any multivitamins or any micronutrient that's available in the nutrition center is going to protect the chances of getting the COVID vaccination, COVID infection. However, if you are somebody who is malnutrition for any reason because of chronic medical condition and immunosuppressed for any reason, and your absorption of food in the gut is impaired because of gut problems, then you would have been advised by a GP or specialist to take extra vitamins that they would have prescribed. Other than that, I would not, if I were you, just keep buying these micronutrients or vitamins from the nutrition center, because what happens is you'll be spending more money, but not necessarily protecting yourself. And it'll also give false assurance that, oh, I'm taking all these, I don't need vaccination. That's not true. So I would certainly sincerely advise that there is evidence does not suggest that yet.
Thanks for answering.
Thank you. We have one more question. Are you aware if any particular age group are more vulnerable to the new variants that are circulating?
I don't think there's any evidence of a particular age group. All we do know is that the younger generation, especially in Slough, are generally less vaccinated. So therefore, if they're actually picking up the virus more from our statistics, we just know the younger population is less vaccinated, they're more likely to catch the virus. So it may seem that there's more cases in younger people, but that's because there are more younger people that aren't vaccinated, rather than the actual virus being more transmissible in that age group.
Thank you, Dr. Kumar. So I think that's all our questions. I do understand, yes, there may be more questions, so please email us if you haven't had a chance right now, or if you think of something later on, we can answer your questions at a future session. Thank you, Dr. Nanda, and thank you, Dr. Kumar, for helping clear some misinformation around the vaccines. Thank you to the participants for taking your time to join us this morning. And please email us with your questions. Let us know if you need more information on vaccines. Contact us if you need to know where to get vaccinated, or even if you're struggling to get to the vaccine center. We can help you. You need to reach out to us. There is help. You only have to ask. I wish you all a pleasant rest of the morning, and I hope you can join us at future sessions. Please go to our webpage to find out any details of when these future sessions will be hosted. And please stay in touch with us via the website or emails. Thank you all and have a good morning.